Everybody, thank you for joining us today in our monthly webinar series here at AMCEDA. Today we are discussing decrypting the security risk assessment, the SRA requirements for meaningful use. Today's presenter is Andy Petrovich, our resident SRA expert. My name is Bruce Mackey, and I am today's moderator. A couple of housekeeping items to start us off. The lines today are all muted. If you have a question for Andy, please feel free to type that in the GoToWebinar interface, either the chat or the questions box. And at the end of the presentation, Andy will be happy to address any questions that you might have. The slides for today can be downloaded right now. They are posted to the AMCEDA website. I just put in the link into the chat box. If you're unable to see that, if you navigate to www.amceda.org, click on the Resources tab, and then scroll down to Webinars. There's a link there to download a PDF version of today's slides, and that is where we archive all of our past webinars as well. So you can link to past slides and links to YouTube to our recordings as well. Okay, so I'll start off just discussing, as we usually always do. For anyone who's seen these three slides 100 other times, I apologize. But for anyone who does not know who AMCEDA is, we are the Michigan Center for Effective IT Adoption. We are one of originally 62 ONC regional extension centers that were set up under the High Tech Act. Essentially, we're here to kind of be the boots on the ground to assist providers through the Meaningful Use program. We are funded by SRA of 2009, otherwise known as the Stimulus Plan, and our purpose is to support the triple aim by leveraging health IT. AMCEDA's performance to date, we have helped over 5,700 providers, impacting 1.6 million patients annually. About a little over 4,500 of those providers are live on an EHR, and a little over 3,800 of them have achieved meaningful use standards under our guidance. AMCEDA's services are highly subsidized for qualified providers. These health IT services include meaningful use support, all stages, all years. Does not matter what stage of year you are in, we are happy to assist you. We offer the security risk assessment, which is, of course, an embedded part of our meaningful use support. But if you have the meaningful use objectives and measures handled and just need the security risk assessment, we offer that as a standalone service as well. We offer something called targeted process optimization, which is essentially a scaled-down version of lean principles that can be used for any clinical or operational practice improvement initiative. So whatever issues you are having in the practice, if you would like help, we've got experts here on staff who would be happy to assist you. And then attestation and audit preparation. If you are getting ready to attest meaningful use, and just need some peace of mind that you've crossed all T's and dotted all I's, or if you have attested and are one of the many, many providers who have been selected for an audit and just need some assistance in responding to the federal or state request for documentation, we are happy to assist with that as well. With that, I would like to turn things over to our presenter today, to Andy, to discuss this security risk assessment.
Thank you, Bruce. Good afternoon, everyone, and thank you for tuning in. There's a lot of information and misinformation about security risk assessments and the HIPAA security rule that's out there. So it's our goal to help you sort through it all by giving an overview of the security risk assessment requirement and what steps are needed to be taken for a security risk assessment. It's a lot more information than we can cover in just one session. So we recommend that you seek out as much knowledge as you can, and we'll point you in the direction of some good resources at the end of the presentation. Risk is something that we all have a sense of. We know that there are risks out there, but we don't want them to stop us from getting out into the world and putting resources to good use. So the question is, how do we ensure security? Well, it's a complicated process. But the first step is awareness. You can't account for risks until you are aware of them. Once you're aware of the risks, how you deal with them is a business or personal decision, but the first step has to be awareness, and the purpose of a security risk assessment is to create or enhance awareness. The purpose of this webinar is also to raise awareness, so let's start with the big picture. The HIPAA security rule is one part of a much larger piece of legislation. It was made law in 2003 with an effective date of 2005. That means security risk assessments have been required since 2005, but many providers are only recently becoming aware of the security risk assessment requirement and the security rule as a whole because of meaningful use. As many of you know, meaningful uses stages 1 and 2 require a security risk assessment be completed as a core measure, and the same will be true for stage 3. The security rule states that covered entities, which are entities that are covered by HIPAA, such as any clinics, healthcare providers, or insurance companies, that those covered entities are responsible to ensure the security of their patients' protected health information, or PHI, or electronic protected health information, or ePHI. Protected health information, PHI, is any health information, including demographic data, that is individually identifiable. There are a number of steps a covered entity must take to ensure PHI is secure. These are outlined in the security standards in the security rule. Covered entities must adopt appropriate administrative, physical, and technical safeguards in addition to other security requirements such as those regarding data sharing and documentation. This table expands on some of the requirements of the security rule that are pertinent to a security risk assessment. Physical safeguards pertain to the facility and immediate location of your practice, such as having locks on your doors, the location of computer hardware or server inside the office, even the structure itself of the building. If your roof's caving in, that's a security concern beyond just information security. Administrative safeguards cover policies, procedures, job descriptions, disciplinary actions, and so on. Technical safeguards pertain to software and system configuration, while the security risk assessment is sometimes thought of as primarily a technical exercise, just a scan of your computers or your EHR. These aspects are really a minority of what the security rule and what a security risk assessment must examine, although the technical aspects are very important. In addition, we've also highlighted policies and procedures which fall under your administrative safeguards. They are required, and the organizations have other requirements as well, such as the breach notification requirements. If you do have a breach of information, it's your responsibility to be aware of it and report it to the Office for Civil Rights. And you also have to have business associate agreements in place with third-party vendors who have access to your patient's PHI. Conversations about information security usually revolve around compliance, and rightly so. You want to be on the right side of the law. But the regulations are in place for important reasons. Namely, unfortunate things happen to patients' personal information, including PHI, and there are serious adverse consequences for consumers affected, in addition to the healthcare system as a whole. You're not just completing the risk assessment because you have to. You're making an investment to protect your organization's reputation as well as your patient's well-being. Between the law, reputation, and patient safety, what is your top priority? It's a philosophical question. I'll leave you to ponder it yourselves. Let's take some time to explore information security and its broader implications, starting with patient safety. If your credit card is stolen or fraudulently used, your bank can often replenish lost funds within a few hours. The stolen identity information, however, can affect patients' reputations, credit scores, even prompt audits from the IRS. If a fraudulent tax return is filed, and fraudulent tax returns are filed at times based on compromised PHI and personal information. Medical information can also be used to blackmail victims, especially high-profile victims who are victims of identity theft. Millions of people are affected every year by loss of personal information, and the costs can be substantial. Over 90 million patient records were reported as being potentially affected by breaches in March of 2015 alone. Often these breaches span many months and were only recently discovered, so it's not to say that 90 million records were breached in March, but suffice to say the previously recorded average of 11.5 million per year of breaches or identities compromised is likely to increase in the face of such staggering numbers. The financial burden placed on patients or victims of identity theft is significant, averaging almost $5,000 per household. And if you do some quick multiplication in your head, you can also get an idea of the staggering economic cost to the healthcare system and the national economy overall. So in light of the philosophical stance of first, do no harm, the staple of medicine, information security is part of preventing harm to patients. Excuse me. With all the news of cybercrime, hacking, and identity theft, it's no wonder the public has concerns about the security of their information. 81% of patients are concerned about privacy and security of EHRs, and 60% of patients believe that EHRs will increase loss of information. In healthcare, one service we offer is giving patients peace of mind. Patients are reportedly uneasy about EHR security, and you can make steps to win their trust by assuring them of your strong security measures and demonstrating how seriously you take their privacy and the security of their information. Another thing to consider is that healthcare breaches are made public. No one wants to see their name or their clinic in the newspaper for the wrong reasons. There are also real-world examples of hospitals using breach information against their competitors with marketing campaigns. Health information breaches have been increasing over the years, and the trend is accelerating. After a sharp increase of 138% between 2012 and 2013, the expected increase between 2013 and 2014 of identities breached is set at 25% currently. And a couple things to note about the 25% figure. First of all, it is based on projections prior to the March reportings of major breaches, so we might expect that number to go up for 2014. And also, while 25% is less than 138%, it is a 25% increase building on the previous increase, which was very large. Over the last 6 years, the number of data breaches reported by the healthcare sector has grown at such a rapid rate that it now surpasses the retail industry as the leading sector within the United States. In 2009, healthcare had only 14% of all reported data breaches, while the retail sector had 41%. In 2013, we hit the inflection points where the number of data breaches within healthcare increased to 43% of all reported breaches, surpassing the retail sector, which was at 34%. And the high-profile breaches in 2014 and recently should not be expected to reverse this trend. It should be noted that this growth is despite the increased awareness of information security. EHR adoption and the spread of digital health information have been sped up by initiatives such as Meaningful Use, the Affordable Care Act, as well as accountable care organizations and health exchanges. While these improve legitimate access and are a great benefit, they do present increases in access that could be potentially illegitimate. And so the importance of security increases along with them. On the subject of breaches, here's a list of recent major breaches. The top three are the largest healthcare breaches listed on the Office for Civil Rights Wall of Shame. The Sony breach is included because, although it was much smaller, it was a high-profile example and has influenced policy in the United States, including a recent executive order on cybersecurity issued by President Obama. As you can see, healthcare information has been a hot target in recent months, and these are really some impressive numbers, with insurance companies being the largest targets, and also a breach not too long ago of a health system of about 4.5 million patient records, which up until March of this year, the community health systems breach was the largest recorded healthcare breach on record. That record, as you can see, has since been smashed. So now that we understand some of the big picture reasons to conduct a risk assessment, let's take a closer look at the process itself. The security risk assessment is the first part of a larger security management process required by HIPAA. The risk assessment requires covered entities to conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of ePHI held by the covered entity. This requires the organization to examine itself from top to bottom in the context of its broader environment. Internal as well as external factors need to be assessed, as well as how they influence each other. Risk management requires covered entities to implement security measures sufficient to reduce risks and vulnerabilities to a reasonable and appropriate level. The appropriateness of these security measures is informed by the risk assessment results. Covered entities must apply appropriate sanctions against workforce members who fail to comply with the security policies and procedures of the covered entity, and further implement procedures to regularly review records of information system activity, such as EHR audit logs, access reports, and security incident reports. Keep these records on file for 7 years in case they are needed to support your security program during an investigation by the Office for Civil Rights. Supporting documentation is always requested during an Office for Civil Rights breach investigation, so make sure you document everything you're doing. You'll be doing the work, so make sure you get credit for it. As many of you know, a security risk assessment, as described previously, is also a requirement to attest to meaningful use. Conducting a security risk assessment for meaningful use is a crucial first step in a risk management program if you haven't done one already. For meaningful use, it is important to make sure that your security risk assessment is conducted during the year of your reporting period, and most importantly, prior to attestation. Meaningful use requires a risk assessment that meets HIPAA security rule requirements. That's the 45 CFR 164.308A1 part. So be sure you are basing your process on the security rule. Corrective actions need to be completed as appropriate, and it is important to show documented improvement on identified risks and remediation of those identified risks year to year. While meaningful use requires a security risk assessment be completed each year prior to attestation, the HIPAA security rule is broader, and in order to achieve compliance, you need to address and meet all of its requirements. Security impacts patient and family engagement as well as other measures. For example, patients who are confident in a practice's information security may be more likely to use a patient portal and share their information via the EHR, which is another core meaningful use requirement. While the security risk assessment requirement is a small piece of the overall law of HIPAA, it has raised a number of questions. So to clarify what a security risk assessment needs to be, the Department of Health and Human Services Office for Civil Rights, or OCR, has issued guidance on risk assessments. Starting with the scope of the risk assessment, it must include all electronic protected health information in your organization. So it's not limited to just your EHR. Any and all devices which transmit, store, or process electronic protected health information must be included, as well as the policies and procedures governing the use of those devices, the personnel who use the devices, and the physical location those devices are kept in. The next step is data collection and methods. Those all need to be documented. You need to show not only the information itself, but also the method of acquisition of that data. You need to identify and document anticipated threats and vulnerabilities that your organization and your sensitive information are facing. You need to assess current security measures in place and assess their effectiveness. You need to establish the likelihood of a threat occurrence or a vulnerability being threatened by an internal or external factor. And then you need to establish the potential impact of one of those threats occurring. And combining the likelihood and the impact of the threat potentially acting on a vulnerability will determine your level of risk. You need to document your complete risk analysis as well as all the steps needed to complete it, and conduct a periodic review and update of your risk assessments, which, of course, also needs to be documented. There's no one way to do a security risk assessment, but every method must meet these basic outline objectives. We've been talking a lot about risk, but if we're going to precisely assess it, we need to define it. The following is a paraphrase of the National Institute for Standards and Technology, or NIST, definition of risk. Risk is the potential or likelihood of a negative outcome or impact toward an asset due to a vulnerability being exploited by a threat that would reduce the value of the asset to the organization. So you can see there shared language between the HIPAA security risk assessment guidelines and the NIST definitions. Generally speaking, the interpretation of HIPAA is greatly informed and expanded upon by NIST special publications, including the one from which we obtained this definition, which is ST 800-30. To put it another way, risk exists when you have a valuable asset that contains some vulnerability, and a threat exists to potentially exploit the vulnerability and diminish some or all of the asset's value. That potential is what we call risk. Let's say you have a laptop with some PHI stored on it. Its portability, while useful, presents a vulnerability as well, in that it could be more easily misplaced or taken. A person entrusted to the laptop may leave it sitting out at a coffee shop while they step away for a minute, and when they come back, it's gone. So this highlights how every asset presents vulnerabilities, and its characteristics define the vulnerabilities and potential threats that can act on those vulnerabilities. And it's useful to think about exactly what is being protected. When we talk about the value of an asset, what do we mean by that? What is the value of PHI? The targeting of PHI by hackers and other subversive entities indicates its value as an illicit commodity traded among criminals, and you can tie a certain dollar amount to patient records on underground markets. But let's consider the value of PHI when it's used legitimately. The security rule requires that we protect the confidentiality, integrity, and availability of ePHI. These three variables are where the value of the information comes from, and if any one of them is compromised, that value is reduced. Confidentiality means basically you can't get to the information unless you're supposed to. The information is kept private and used appropriately. When this is compromised, the very identity of the patient in front of you or requesting access to records could be in question, among other potential harms. Integrity means the EPHI is accurate, complete, and up to date. For example, if a patient's chart reads, "do not resuscitate" or "no allergies" to medications, you need to be able to trust that those statements are accurate. Finally, availability means that the EPHI can be accessed when needed. If you can't have the information when it's needed, your ability to administer quality care is impeded. On the subject of availability, the availability of PHI always presents some manner of vulnerability. Every system, every asset has some kind of vulnerability. We need to be aware of vulnerabilities and come up with a way to protect the asset while still being able to meaningfully and legitimately use it. Consider gold in a vault. If the vault were completely sealed off with no way to access it, then it would be very secure, but we would not be able to get value out of the gold. So we create access by installing a door, but the door creates a vulnerability as well. So you want to make sure that your door or your access point has controls in place to make sure that access is legitimate. Controls are all about making the figurative door as difficult as possible to get through while allowing us to get value out of the asset and not seriously impeding our ability to do so. It's a balancing act. It's a process of authentication, a barrier you can only get through if you're supposed to. In a healthcare setting, controls to protect patient information exist in the form of locking doors, separating the waiting room from care areas, monitoring traffic on your computer networks with firewalls, training staff how to properly process and transmit PHI on information systems, and so on and so forth. Depending on the value of the assets and the need for timely access, controls vary in flexibility. As an example, it takes fewer steps in an authentication process to get money from an ATM machine than it does to draw out of a trust fund. Similarly, an EHR server should have stronger security and normally will have stronger security than an email server. Going back to the vault analogy, not all the money is kept in at all the time. Assets likely to be exchanged more frequently are kept up front with lighter security measures in place. And again, the risk assessment can inform the level of risk needed to protect your assets based on availability as well. It's really all about having a nice balancing act. Now that we've considered vulnerabilities, let's talk about threats. Here's a question to ponder. Do the majority of breaches originate from an internal or external source? I'll give you a moment. Well, the answer is internal. The majority of breach incidents can be traced to an internal source. For example, lack of awareness among personnel due to improper training, users bypassing the organization's requirements that are put in place by using unauthorized devices and programs for official business, which is referred to as shadow IT, lack of enforcement of policies and procedures, and also sometimes malicious or disgruntled employees. These are the common root causes of breaches. Hacking and external threats are on the rise, and while recent breaches appearing to have involved malicious outsiders have resulted in the largest number of records being breached, most breach incidents are smaller in scale and result from internal factors. It is also important to consider potential threats in the external environment, such as natural disasters and infrastructure failures. How is your organization prepared to maintain secure access to PHI in the event of a regional 3-day-long power outage? Also something to consider, especially in light of business associates being included in the chain of liability for a HIPAA breach, is the overlap between internal and external sources. Business associates are technically outsiders, but they have insider access. And so how you manage the risk of doing business with them should be considered accordingly. We'll talk more about business associates. Business associates are vendors who work with HIPAA-covered entities to process, store, or transmit PHI. They are required by HIPAA to sign business associate agreements, and it is the covered entity's responsibility to make sure this happens with the business associates with whom they're contracting. The business associate agreement formally extends HIPAA requirements for safeguarding PHI to those vendors who would otherwise not be covered by HIPAA. While the agreements are required, it should be noted that business associates are defined by their relationship to covered entities and are legally subject to HIPAA requirements by virtue of that relationship, even if the business associate agreement is not in place. If the agreement is not in place, then that is a risk the covered entity faces and needs to address. Disputes between covered entities and vendors can have serious consequences. There's an ongoing lawsuit in Maine where a small clinic has lost access to their PHI, to all their patient records through their EHR, due to a billing dispute with their EHR vendor. This highlights the importance of making sure your contracts and agreements spell out precisely how you can maintain the security of your patient's information and access to it, even in the event of a contract dispute or potential breach of contract. We've discussed malicious outsiders and insiders and threats. But what if you have a malicious business associate that is, in effect, both outsider and insider? A classic example is that of Edward Snowden, who was a contractor to the National Security Agency, but with insider access to highly confidential information. How can you make sure your sensitive information is secure in the hands of a business associate? The solution is good vendor management. That is the key. For one, you need to make sure you're vetting potential vendors with whom you're going to be doing business, business associates. You want to have a good idea of their security posture and their integrity going into the business relationship before any agreements are signed. And you want to have frank discussions with your existing business associates about information security. They need to be taking the security of your PHI seriously. Do they have written information security policies and procedures? Are their safeguards reasonable and appropriate? Do they conduct security risk assessments on a regular basis? Do you think your business associates would pass a HIPAA audit? How can you know? If your answer to the previous questions was no, that business associate relationship could present a risk to your organization. As a bit of an aside, a quick note on encryption. There's some ongoing misunderstanding about whether encryption is required by HIPAA. And since encryption is specifically called out in the 2014 updates to meaningful use measures, I'll provide a brief explanation here. Encryption is addressable, that is to say it's an addressable specification in the HIPAA security rule, as opposed to a required specification. But that does not mean it is optional. An organization opting not to encrypt their data has to provide a lengthy written explanation of why encryption is not applicable to their practice and what equivalent safeguard has been put in place instead of encryption. I would challenge anyone to find an equivalent solution to encryption that is not essentially encryption. And the vast majority of organizations will find encryption to be the best solution for securing their data. Encryption also provides a safe harbor in HIPAA such that encrypted ePHI loss is not necessarily considered a breach as long as the encryption key was not also compromised. Finally, a little more clarification. Per NIST guidelines, organizations should encrypt ePHI at rest, such as PHI stored on a hard drive or a server, and in transmission, such as secure connections to your hosted EHR, to a public health reporting agency, to your patient portal. So here's the rub about compliance. Even if you are compliant, that doesn't mean you can't suffer a breach. Any audit prep or evaluation that gives you a stamp of compliance is, at best, a snapshot of your compliance status at a single instantaneous point in time. There are no guarantees that things won't change at any particular point in time in the future. And audits themselves are subjective. There's always some variation in what different individual auditors might prioritize or scrutinize versus others. So compliance isn't enough. Risk can never be eliminated. The important thing is to reduce risk to a reasonable and appropriate level, which can be a frustratingly subjective way of thinking about it, but that is the mandate per the HIPAA security rule. You want to focus on critical assets and protecting ePHI. Your security risk assessment will help you prioritize risks, but it's up to you to take security and risk seriously. Security risk assessment results need to be integrated into routine operations on a regular, really continuous basis. You need to formally designate a security officer and involve them early on in any major decision-making process. Make security part of your organization's cultural awareness and priorities. Everything needs to be taken into account, but you can't protect everything totally. Maintaining awareness through consistent consideration of security is your best bet to keeping patients' ePHI safe. The expectation from the Office for Civil Rights is for organizations to put forth a good faith effort and, of course, prove it with documentation. On the subject of awareness, just want to make you aware that the Office for Civil Rights has announced that they will be starting a random audit program for covered entities and business associates in 2015. Originally, the program was set to launch in 2014, but has been delayed. Organizations' compliance with either the HIPAA security, privacy, or breach notification rules will be assessed through either on-site or remote audits. Now, when I say or, that doesn't mean that they're only going to be doing one combination of those variables for everyone. Every person that could be, or every organization that could be audited will be audited based on one variable from each of those two categories when it comes to which rule and whether or not the audit will be on-site or remote. They conducted pilot audits from 2012 to 2013, and the most significant findings from the security rule audits from that pilot program were lack of or incomplete security risk assessment and a lack of awareness of security rule requirements. So it's something to take into consideration as you're moving forward, deciding whether or not to conduct a security risk assessment. That is, those most significant results that they highlighted in their reports are what they can be expected to be focusing on most stringently in the upcoming audits. And now, while we're on the subject of audits, we want to avoid confusion between meaningful use and HIPAA Office for Civil Rights audits. So let's clarify the difference between them. Meaningful use audits are conducted by a firm, Figliozzi and Company, under contract with CMS, and they will occur for a relatively larger number of practices and providers. Purportedly, 10% of providers who attest to meaningful use in any given year will be subject to an audit. These audits are random, but if a provider fails an audit in 1 year of meaningful use, they will most likely be audited the following year as well. So they're not entirely random. The meaningful use audit covers all of the measures and reported figures for that year of attestation and can also look at multiple years of attestation. So this includes the security risk assessment requirement, but as the security risk assessment requirement is only one piece of what they're looking at, it's only one part of meaningful use audit, the investigation into your security risk assessment as a part of that meaningful use audit is focused on a few key variables. And those are the proper timing, the proper scope, the remediation of identified risks from the previous year's risk assessment if it's not the practice or provider's first year of meaningful use, and certain key security activities can also be examined, such as the review of EHR audit logs. In contrast, HIPAA audits are focused exclusively on one of the 3 administrative rules under HIPAA: security, privacy, or breach notification. They are more focused in scope and will comprehensively evaluate an organization's compliance with the selected rule. In the case of a security rule audit, an organization's risk management program, including documentation of risk assessments, will be conducted. All covered entities and business associates have a chance of being audited, but it is very small, with only a few hundred being audited for the security rule per cycle. Most OCR investigations occur following a reported breach of PHI, so while your risk of being randomly audited is very small, your risk of being investigated using the OCR's audit protocol, which much more stringently looks at your risk management program, needs to be considered in the context of your risk of suffering a breach of your PHI. So the best way to prevent an OCR HIPAA security audit is to prevent a breach in the first place. Think of information security as an investment in your business. Your stakeholders benefit from ownership to patients to employees when an organization keeps its sensitive information secure. Make sure staff are educated and aware of security requirements, including HIPAA requirements, as well as your internal policies and procedures, which may go above and beyond what HIPAA requires. Your staff, your front lines, your providers, they are the front line of prevention. It's important for a culture of security awareness to be established by good safeguards and good practices being practiced consistently at all levels of the organization, including management and medical providers. Make sure your risk management process is self-reflective. You want to assess risks and your remediation of risks and the effectiveness of your remediation of risks. Examine the effectiveness of your policies and procedures and how they might be improved. You may need to add, you may need to refine. Some efforts may prove to be more of an obstruction than they're worth, so may need to be removed. This sort of thinking regarding your risk management program should be a regular part of operations and decision making. And finally, treat your business associates as if they were insiders. Same expectations you have of your personnel, you should be satisfied that those expectations are being met by your third-party vendors. Be confident you can trust them by getting the information you need to assure you of their sound security measures. At the end of the day, no one wants to be a security guard asleep at their post. Referencing the picture on the screen, normally I really object to the improper use of quotation marks for the purpose of adding emphasis to what's posted. But in some cases, those quotation marks may actually not be so inappropriate. The OCR emphasizes time and again the primary importance of conducting a risk assessment. So let's review the exact steps of a security risk assessment process following the NIST guidelines and HHS guidelines. Step one is to identify and classify assets. This is defining the scope of your risk assessment, which needs to include all IT equipment on site that stores, processes, or transmits ePHI. So not just the EHR, but any computers, copy machines, printers, faxes, or portable storage media should also be included. Step two is to identify and classify threats and vulnerabilities to those assets, to your ePHI stored on those assets. The third step is to assess your current controls. And the fourth is to determine the likelihood of a threat occurrence. Fifth, analyze impact to your organization. Again, impact is defined as the negative outcome to the organization's confidentiality, integrity, or availability of ePHI. Then step six, again, is to determine your level of risk, which is a combination of the likelihood and impact of an asset's vulnerability being exploited by a potential threat. Remember the definition we went over. The seventh step is to implement security controls or improve security controls as informed by the results of your risk assessment. And then eighth is to integrate these results in your ongoing risk management program, which includes a recurring security risk assessment review. The risks facing your organization are constantly changing, so it's important that you are periodically updating your risk assessment to account for that. And of course, all steps need to be documented. You're going to be doing this work. You are doing this work. Make sure you're getting credit for it. You can prove that you are doing it. Again, there's no one way to do a security risk assessment, but all of these steps need to be taken. And for all steps, document your actions. A positive side of the security rule is that it's flexible. But its flexibility presents its own challenges, much like access cuts both ways, so can flexibility. There's not much specificity regarding exactly what needs to go into, for example, an impact analysis. Now, I know most practices, most organizations, most managers want certainty when it comes to compliance. They want to be informed of what to do it, and move on. But information security in the real world, it is a very real thing. These threats, the impact of these threats, they're abstract ideas. We put them on paper, but they are very real. And it is an organic, constantly changing process. Threats evolve. Threats become increasingly sophisticated. Vulnerabilities can expand in the face of those. And it's important for an organization to keep up in a way that matches the reality of the threats in the environment that they're facing. And the flexibility of the security rule is designed to reflect that reality that we live in. So think of the terms reasonable and appropriate. In the HIPAA security rule, the language comes up time and again, reasonable and appropriate safeguards, reasonable, reduce risk to a reasonable and appropriate level. So it's a subjective term, but if it seems like you're not doing enough, if you feel uneasy about your safeguards, your security measures in place, if you're not sure if your security risk assessment has addressed all the things that it needs to, you probably are concerned for good reason, and you should follow through on that with decisive and productive action. If your security risk assessment and its results mean something to your organization and you are able to realistically act on its findings, then you're on the right track. These are the steps your organization needs to take for the sake of compliance and reasonably assuring patient safety as well as your reputation. So let's say you're reporting on all your meaningful use measures, things are looking good, and you're ready to conduct your security risk assessment with the goal of using it to attest to meaningful use. What do you need to know to make sure that your security risk assessment will enable you to legitimately attest to meaningful use? Based on the most recent CMS guidance, the security risk assessment must take place no earlier than the start of the EHR reporting year and no later than the provider attestation date. You should also be assessing your certified EHR technology, so make sure that is installed and operational prior to conducting your risk assessment. You also need to conduct the risk assessment for each reporting year of attestation prior to attestation. The FAQ 10754 is listed there. You can feel free to Google that and read a more detailed explanation. And also in the PDF version of these slides that are available, that is a hyperlink that will navigate directly to it. Risks identified in the risk assessment don't need to be addressed prior to attesting to meaningful use for the year of that risk assessment. However, you do need to mitigate the risks identified, and meaningful use audits often look at multiple years of data. So be absolutely sure you have documentation to demonstrate that corrective actions have been taken to mitigate identified risks. Especially if you're doing subsequent years of meaningful use, you want to demonstrate sequential improvement on the risks that are identified. The expectation is not that you're going to have perfect security, but you want to have documentation showing that you're addressing the items that you've identified and are taking reasonable and appropriate steps to protect your patient's information. A commonly asked question is, how often does a practice or provider need to complete a security risk assessment? We've touched on that, but let's parse it out a little more. If you're participating in meaningful use, you need to do one every year for which you are attesting to meaningful use. Either conduct or update a previous risk assessment. Also, you should update your risk assessment every time you have major changes to your organization that affects your EPHI, such as moving office locations, upgrading your server operating system if you have a server, if you're upgrading the hardware to operate your networks, or if you're upgrading the operating system on your computers, similar major changes like that, you'll want to update your security risk assessment to make sure that it is reflecting realistically the actual environment of your practice. If you're not participating in meaningful use, it is recommended for covered entities and business associates to conduct risk assessments at least annually. Though there is no specific frequency required by HIPAA, that is generally the standard is annually at least. You may find your organization able to do a security risk assessment on its own, depending on the resources you have available. But MCETA is able to help. We've conducted risk assessments for our clients, and we have a toolkit that we can offer to you. MCETA's security risk assessment service and toolkit is based on NIST guidelines primarily, and other guidelines as well, including the HIPAA security rule. In particular, special publications 800-30 and 800-66 were used to inform our security risk assessment process. Our process involves working on-site with practice leaders to get a clear snapshot of your organization's the threats, vulnerabilities facing it, as well as safeguards you have in place. We guide you through each step of the security risk assessment process and provide a deliverable of documentation of our security risk assessment process and a recommended plan of action to improve compliance. We also provide tools to assist with compliance, including policy and procedure templates and other tools to assist practices with remediation. We know that for many of you, providers and medical practices, you're in the business of providing medicine. You don't want to necessarily have to build an entire risk management program from scratch, from the ground up. So we certainly have resources available to help you with that, having done much of the legwork so that you can be confident in your security posture. So in conclusion, security risk assessments are required for compliance with HIPAA and meaningful use. Risk that organizations are facing, as well as the regulatory oversight that organizations are subject to, are increasing. And that is not expected to reverse anytime soon. Practices are expected to take security seriously and put forth a good faith effort to protect patients' protected health information. What's required to do this effectively is hard work, diligence, and integrity. A security risk assessment is the first step of a continuous, comprehensive risk management program that will benefit your patients and your practice. Provided a list here of some quality resources for further reading. Again, in the PDF file that's available for these slides, these are hyperlinks so that you can take you directly to the resource just by hitting Control-click if you download the slides. And with that, I would like to thank you for joining us today and would be happy to answer any questions. You can also see here some of our upcoming webinars and our contact information if you want to reach out to us. So again, thank you.
Thank you, Andy. Appreciate it. I just had a couple of questions that came in, and we are nearly out of time. So first question is, what if you are on a cloud with your EMR?
Well, if you're on a cloud, you still need to conduct the security risk assessment. It's just simplified a little bit because you're not going to have your server on site. But again, all of the devices that process, store, or transmit ePHI need to be considered in your risk assessment. So fax machines, complicated, multi-purpose fax, copy, print machines, these store information. So even if you're not storing PHI on your hard drive, on your computer, some information is still stored in temporary directories on your hard drive, in some of these devices in your practice. And you also want to be considerate of the fact that your staff may be utilizing shadow IT. They may be storing things on their hard drive that you're not aware of. So you want to make sure that you conduct a risk assessment to address all of those possibilities.
All right. Thank you, Andy. We'll go through one more quick question. We attested to 2014 meaningful use in March and conducted our SRA in January 2014. Do we have to do another SRA for 2015 meaningful use?
Yes. Our answer is yes. And CETA does not advise double dipping on risk assessments. There is some flexibility in that CMS FAQ that I provided, indicating that your risk assessment doesn't need to be conducted before the end of your reporting year as long as it's conducted before attestation. But the guidance also states that you need to conduct a risk assessment for each reporting period year, and we're going to interpret that to mean that you need to do a separate risk assessment for each reporting period year. Using the same risk assessment for 2 years of meaningful use, even if it's conducted in the same year, could put you at risk for losing your incentive money if audited.
Great. All right. Thank you, Andy. That is all of the questions thus far. We'll give it just a few more seconds. If anyone has any other questions for Andy, please go ahead and type that into the question box in the GoToWebinar interface. In closing, I just want to reiterate, Andy pointed out the upcoming webinars we have. There's 4 of them listed, or 4 dates and times listed on the slide on your screen right now. So this is the first of a 5-part webinar series that we are launching, that we are teaching folks how to leverage their health IT to manage their hypertension and diabetes patients. So the 4 dates that are there, those are all the exact same webinar. There will be some follow-up webinars that dive a lot deeper into the topics that we cover in these 4 as well. So I encourage you all to sign up for one or, hey, all 4 of those webinars. Someone else asked about PDF to the slides. Yes, as always, our slides and videos are posted to the MCEDA website. If you navigate to mceda.org, click on the Resources tab, and then scroll down to webinars. You'll see a link there for the slide deck for today's presentation, as well as all of our past presentations and recordings as well. So with that, I would like to thank you all for attending today's webinar, and hope you have a great day. Thank you.